From the Lever's reader-supported newsroom, this is Lever Time. I'm David Sirota. If you've paid attention to the news of late, you've probably heard a lot about a jeans ad featuring movie star Sydney Sweeney. What you might not have heard about is the massive healthcare emergency about to explode on America in the next few months. It's crazy-making. It's like everyone is ogling the sultry blonde celebrity as an asteroid heads towards millions of families. Just don't look up, right? Well, today on Lever Time, we're going to look up. We're going to tell you about the huge health insurance premium increases that are about to crash into millions of families in the next few months, and how you could be priced out of your medical care. These aren't run-of-the-mill increases. We're talking about spikes of up to 66%. Why are they happening? What's changed? Can anyone stop this incoming disaster? And can you do anything to protect yourself and your family? We talked to two of the country's top experts to get you some answers on today's episode.
You may have heard about the controversy surrounding an American Eagle ad starring actress Sydney Sweeney.
Genes are passed down from parents to offspring.
The latest front in the culture wars is leaving viewers distressed.
Earlier this month, America's media and Donald Trump worked really hard to distract you by creating a controversy out of an ad for blue jeans.
Sydney Sweeney is a registered Republican. I think her ad is fantastic.
Trump weighing in on the Sydney Sweeney ad was a brilliant form of misdirection. It generated a whole new round of headlines, helping to continue averting attention from his recent legislation that gives $1 trillion of tax cuts to rich people and pays for it by throwing millions of working-class Americans off Medicaid. Now, maybe you remember briefly hearing news about those Medicaid cuts before the Sydney Sweeney controversy and all the other fake controversies drowned that news out. And maybe if you aren't on Medicare, maybe you didn't worry. Maybe you figured the situation didn't affect you directly. You knew things were bad, but amid all the chaos and the panic, perhaps your inner monologue was a bit like Han Solo in Star Wars.
Everything's under control, situation normal.
Well, I have some bad news for you. Even if you aren't on Medicaid, everything might not be fine or normal for you and your family when it comes to medical coverage, because the Death Star of American healthcare, the insurance companies, are preparing to blow up the lives of millions of middle-class Americans.
Continue with the operation. You may fire when ready.
What?
You're far too trusting.
The insurance industry's weapon of choice is not a giant planet-destroying laser beam. It is giant family budget-destroying premium increases for 24 million Americans who buy their health insurance on Affordable Care Act exchanges. Now, when I say giant premium increases, that is not an overstatement. Insurers in 19 states are requesting a median premium increase of 15%, according to data compiled by the Kaiser Family Foundation. In some regions of the United States, insurance companies are pushing to raise premiums by as much as 66% for some policies, all while the largest insurers are doling out billions of dollars to further enrich corporate executives and shareholders through stock buybacks and dividends. Now, maybe you're thinking a 15% premium increase is a problem, but maybe, like the Star Wars pilot Porkins facing down the Death Star, you're thinking you can still survive.
Eject! I can hold it!
But then, on top of the premium increases, comes the laser blast of subsidy cuts.
Pull on! No, I'm all right.
Trump's tax bill gave $1 trillion of tax cuts to the richest 1% of the country, but excluded a $335 billion extension of the Biden-era subsidies for people to buy insurance on the Affordable Care Act exchanges. Without such an extension, those subsidies will expire at the end of 2025. That means the subsidies for lower-income people will be reduced, and the subsidies for middle-income people could be entirely cut off. That's right, couples whose annual income exceeds $84,600 and families of four whose annual income exceeds $128,600, they could get no subsidies at all. The result? In at least 12 states, people who buy their health insurance through their state marketplaces rather than through their employer, they could see their premium payments double starting on January 1st. And if you think I'm exaggerating here, don't take my word for it. Listen to one Republican lawmaker recently admitting that this is all happening.
The cost of insurance is just going to explode for families, working people across the nation. I mean, already we're seeing the premium increases are unbelievable.
That's Republican Senator Josh Hawley.
If we don't do something about that, we could see people paying double what they're paying now. I just don't know how working people are going to afford it.
At a time when 44% of Americans say they're having serious trouble paying for health insurance, this is nothing short of a national emergency. Feel free to take a moment right now to angrily scream like Luke Skywalker. When the Affordable Care Act was first proposed, I and many others warned that the legislation would end up giving way too much political and financial power to the health insurance empire that had helped create the healthcare crisis in the first place. But it was sold to Americans as at least giving us a reliable deal. We'd still have to pay insurance industry middlemen who stood between us and our doctors, but at least it would be affordable. It said so right there in the bill's name, right? The problem, though, was that the Affordable Care Act empowered insurance companies to keep jacking up premiums, and it left the subsidies to the whims of future presidents, in this case, Donald Trump. The Affordable Care Act lets him now behave like the imperious Darth Vader, telling us that when it comes to our health care,
I am altering the deal. Pray I don't alter it any further.
Right about now in the healthcare story of America, it feels like we're at the end of Empire Strikes Back. The good guys have gotten the shit kicked out of them, and the Empire seems to be totally in command. But this is not the end of the story. I'm not guaranteeing the next chapter will be Return of the Jedi, but it seems as if people might be waking up, and that this fight over healthcare is far from over. You just heard Republican Senator Josh Hawley allude to the fact that Congress could do something about this, which is absolutely true. And a recent poll from Trump's own Republican pollster shows that if congressional Republicans do not do anything, they could get destroyed in the next election. That poll showed that 72% of voters in key congressional swing districts want the tax subsidies extended, and that includes 55% of Trump voters. And here's an even more important number. The poll found that if the healthcare subsidies are not extended, generic Democratic candidates jump to a 15-point lead against generic Republican candidates in those districts. Many voters are now pressuring their representatives to do something. This is from a congressional town hall in Lincoln, Nebraska.
Every working and retired American should be entitled to health care. Would you sign on or write up a bill for Medicare for all? We've got Medicare.
Here's Republican Representative Mike Flood's answer.
We can't afford that.
Yes, you can.
So the boos are coming from both sides. Most Americans want this, and Democrats are making a big issue out of it.
Premiums will increase for 20 million Americans. A typical family of four will see a $10,000 increase when those premium tax credits go away, and a typical 60-year-old couple would see a $17,000 increase.
This is New Hampshire Senator Jeanne Shaheen at a recent press conference demanding Congress renew the Affordable Care Act subsidies before they expire at the end of the year.
And because of those increased costs, Americans are going to lose their health care coverage.
I have so many questions, and I bet you do too. For starters, why exactly are insurance companies raising their prices so much? Is it because they have to, or because they can? And who exactly is pushing for all of this? Is it the insurers? If not, then who? And if the answer is nobody, then why are Trump and Republicans doing this? What the hell is their motive? And most important of all, what are the chances that this disaster can still be averted? Today, I'm asking those questions to two of America's leading experts on the healthcare system. After the break, they're going to give us some answers. Welcome back to Lever Time. To find out when and why health insurance premiums are about to explode, I called one of the primary researchers who sounded the alarm over these big rate increases.
I'm Larry Levitt. I'm Executive Vice President for Health Policy at KFF.
KFF stands for Kaiser Family Foundation. It's an organization that publishes health policy research.
We're a nonpartisan health policy organization, and I've been working on healthcare issues for longer than I care to think.
Larry Levitt previously served in the Health and Human Services Department under President Bill Clinton, when that Democratic administration was pushing its universal health care legislation. And Levitt has worked on health policy for California's insurance commissioner. So I wanted to ask Larry, why are insurers cranking up rates across the board? The answer has everything to do with exchanges, those marketplaces created by the Affordable Care Act, where people who don't get insurance through their employers can shop for their own health insurance plans.
This goes back to the creation of the Affordable Care Act, or Obamacare, which passed in 2010. And the idea was to create a place where people could get health insurance if their employer didn't provide it, if they weren't eligible for Medicare or Medicaid. And there were a bunch of protections that came along with that. So protections for people with pre-existing conditions. Insurers can't deny you coverage. They can't charge you more if you have a health condition. And importantly, there were tax credits or subsidies to help people pay their premiums. Because if you're buying insurance on your own, it's expensive and most people can't afford it.
So the first thing happening here is that insurers are proposing massive premium increases ahead of the new year, that they are submitting these requests for approval for premium increases. And I think the first question on that is, if people see headlines about that in their state, why are they saying they're proposing this? What is their justification for submitting these increases? Oh, and also some context on how big these increases are.
These increases are big. They're averaging about 15% so far based on insurers that have submitted them to date. And those are the biggest increases that we've seen in the Affordable Care Act marketplaces since 2018, which coincidentally was the last time Donald Trump was president and created massive uncertainty in the ACA marketplaces. Insurers are giving a number of reasons for the increases. One is just increasing healthcare costs, drug prices going up, hospital prices going up, people using more care. That's normal. One is tariffs, all the tariffs that President Trump has threatened or imposed. Insurers are saying that's going to add a few percent to the premium increases because it will increase things like drug prices or the costs of medical products. The other big thing going on is that enhanced subsidies or tax credits that were created by President Biden and Democrats in Congress in 2021 are set to expire at the end of this year. Those enhanced tax credits have been enormously helpful in making coverage more affordable for people. And in fact, enrollment in the ACA marketplaces has roughly doubled since 2021 when that additional financial help was available. If those tax credits expire at the end of this year, if Republicans don't agree to extend them, that means enrollment is going to drop, and particularly will drop among healthier people. So sicker people will try to find a way to keep insurance because they absolutely need it. Healthier people will tend to drop coverage, and that's going to make the risk pool, the pool of people that insurers are covering, sicker, and they're saying they're going to need higher premiums in order to compensate for that.
I also spoke with Miranda Yaver, assistant professor of health policy and management at the University of Pittsburgh. She's literally writing the book on how insurance providers deny coverage.
I have a forthcoming book, Coverage Denied, How Health Insurers Drive Inequality in the United States. As you might imagine, it's a very uplifting subject.
Yaver told me that although it's too soon to say how these new rate hikes will end up denying people necessary care, this battle has been happening since the Affordable Care Act was first enacted. And now, with these latest premium hikes, it's worsening the affordability crisis that the legislation was supposed to remedy.
There will be coverage losses, and the people who stay insured are going to be paying, according to KFF, an average of about 75% more.
I mean, that isn't just an astronomical amount of money. Lower income people who stay on the exchanges, they'll still get some subsidies, but obviously they have less wealth to devote to paying for healthcare. And people who are what we would probably label middle class, people $80,000 for a couple, I think it's 100 and something for a family of four, they could face a nearly doubling of their healthcare bills. I think one question that's come up that I can't figure out is, what is the motivation for this, right? Let's step back here. The insurance companies, they're not opposed to the subsidies, right? As a political interest, as a financial interest. They're not opposed to the federal subsidies that help people buy their product. So the insurance companies presumably aren't lobbying for this. So I keep coming back to this question of who wants this, right? Like, what political interests want the expiration of the subsidies and the subsequent problems?
One of the things that I keep coming back to is the bruising political defeat that they suffered in 2017 with the American Health Care Act.
For those who don't remember, the American Health Care Act of 2017 was legislation proposed by Republicans to partially repeal the Affordable Care Act. It did not pass.
It did not go according to plan, despite their having every lever of political power. And the American Health Care Act was deeply, deeply unpopular. Quinnipiac polling had it around 18%. And
you're talking about the Republicans.
The Republicans. And in 2017, I was constantly playing a game of finding a bad movie that had a Rotten Tomatoes score that would have been better than the American Health Care Act. They were pretty hard to find. It was characterized as the repeal and replace, but they never really had much of a replacement plan. There would be something like 28 or so million fewer people being insured. And basically, this was going to throw a wrench in Medicaid and get rid of the ACA or most of it. And the Republicans were unsuccessful in this effort, and they suffered in 2018. It was pretty easy to write campaign ads that said this person wanted to take away your health care.
Right. And I think you'd presume that the lesson that would be learned is, let's not try to do that again. But it sounds like what you're saying is they learned a different lesson.
Yeah, exactly. I think that they learned the lesson that they should. I mean, the thumbs down, of course, was not in broad daylight. It was 1:30 in the morning. But I think what they really realized was that trying to take away the Affordable Care Act in a way that was very public, in a way that was easily understandable, was going to be politically costly. And rather than invest in new ways to bolster the market and keep people healthier and insured, what they've done, and I really do think that this is just longstanding hostility toward Barack Obama and the Democratic Party that voted for the ACA.
I posed a similar question to Larry Levitt of the Kaiser Family Foundation. If these cuts are so unpopular, and if even the insurers don't want these cuts, then what's the political goal here? Levitt told me that the real reason behind these attacks on the Affordable Care Act may be related to its nickname, Obamacare.
Insurers, doctors, hospitals are all supportive. And the politics are even somewhat upside down in another way. If you look at the states that have benefited from these enhanced tax credits, it is overwhelmingly states in the South with a lot of low-income uninsured people, and states that have chosen not to expand Medicaid under the Affordable Care Act. So like in Florida, there are 4.6 million people enrolled in the ACA marketplace. I mean, it's a huge percentage of the whole state that has this coverage. Those are the people who will get hurt by the subsidies not being extended. And I think a lot of this comes back to the symbolism of the ACA or Obamacare. It's associated with Obama. Republicans have been opposed to it from the start.
I mean, is it literally just like because it was called Obamacare?
Yeah, I mean, you've got these states in the South, Florida, Texas, Mississippi, that haven't expanded Medicaid under the Affordable Care Act, even though the federal government is paying 90% of the cost. And I think so much of that is because of the name, because of who it's associated with.
Miranda Yaver agrees. As painfully stupid as it sounds, the political problem at issue here might be the name Obama.
I really do think that this is just longstanding hostility toward Barack Obama and the Democratic Party that voted for the ACA. They're just finding ways to sneakily but very powerfully sabotage the ACA and essentially be able to, after decades of saying that the ACA isn't working, make this a self-fulfilling prophecy by destabilizing its core provisions. I think that a much sounder strategy would just be to rename Obamacare Trump Care and people get to keep their coverage. But the reality is that the policy is seen as being aligned with the Democratic Party. It shouldn't be. The ACA is actually historically very popular. When Republicans tried to repeal it in 2017, its popularity was pretty much 50-50. Right now, it's around 65%. They know that if they mess with it in broad daylight, it will not go well for them. But they also know the ins and outs of subsidies and the like is above the pay grade of a lot of Americans.
So if you can't take it out in one fell swoop, you try to erode it, chip away at it.
Yeah.
And this is beyond chipping away. I mean, you've got millions of people on the exchanges who are about to either be priced out of healthcare or be priced out of everything else in their lives because of these costs. I mean, I want to go back to that. A doubling of healthcare premiums potentially for millions of middle-class people.
And contrary to Mitch McConnell's assertion in the context of Medicaid that people will get over it, people know whether they can afford their prescription drugs. They know if they have to put some of their groceries back because their prescription drug is costing X number of dollars more. They know when they can't go to the doctor or get their kid to the doctor. And so the fact that these are real, everyday, common experiences by people across the ideological spectrum, I want to emphasize, it really does highlight that this is a politically costly approach. And so now it's the responsibility of people who care about health coverage, and that shouldn't be just one party, to help people connect those dots and hold people accountable.
Since opponents of the Affordable Care Act have faced political opposition to killing the law outright, Larry Levitt says they're instead resorting to other tactics, like making the Affordable Care Act harder to access or strangling its users with red tape.
The Trump administration is putting in regulations to make it harder to sign up for the ACA marketplaces. The so-called One Big Beautiful Bill just passed that eliminates coverage for a number of groups of lawfully present immigrants, makes people verify their income and jump through hoops to sign up for coverage.
Let's talk a little bit more about that. What are some other ways that you see either happening now or coming down the pike where the Trump administration can use the rulemaking process and use essentially the government's power to create paperwork and barriers and complexities that will make it harder for people who are eligible for the kinds of things we're talking about to get the benefits and the coverage they need?
Our health insurance system is already incredibly complex. Even the simplest part of it, Medicare, is extremely complex. But there are a number of things happening now from the Trump administration, from the mega bill just passed by Congress, that's going to make it even worse. So in Medicaid, the biggest source of savings in the tax and spending law passed by Republicans is a work requirement in Medicaid. That's going to make people have to, as often as every month, prove that they're working or prove that they qualify for an exemption. And the vast majority of Medicaid enrollees are already working or would already qualify for an exemption, like they're too sick to work or they're a parent or they're going to school. But people will get caught up in this red tape and end up losing coverage. Imagine someone who's an Uber driver. Their hours vary from day to day, from week to week. How are they going to prove that? Or someone with substance use disorder who would be exempt from the work requirement. Maybe they're homeless as well. How do you prove that? How do you find a doctor to write a note for you to say that you qualify for an exemption? In the ACA marketplaces, there are a whole set of new complexities as well. So historically, when at the end of the year, when open enrollment happened in the marketplace, you would be automatically renewed into your coverage if you didn't do anything. Every year, you just get automatically rolled over. The new rules are going to say that you have to verify your income before you can be signed up for coverage, even if you've been in that coverage for several years now. So that's going to eliminate these automatic renewals. Similarly, these subsidies that help people pay their premiums, technically they're tax credits. And when you file your taxes the following year, there were caps on how much you had to repay. The Republicans are now removing those caps. So someone could end up paying thousands of dollars a year to the government because they got what turns out to be too big a subsidy to help them pay their health insurance.
What you're describing speaks to a deep pet peeve of my own, which is this incredible complexity. It seems like the last many, many years have been defined by government policy being so incredibly complex, so as to create a barrier to the very things that the policy is purporting to provide to the public. Do you think that's by design? Or do you think it's just like we haven't taken seriously the idea of making this simple? In other words, is there some sort of diabolical motive to using complexity to deny the public the things that it is being promised it's getting? Or do you think it's just that there hasn't been enough of a focus on making the end user experience in healthcare much more simple?
Our system breeds complexity. In other countries, you are automatically covered, no matter what your circumstances. That's not how it works here. We've got Medicare, Medicaid, the Affordable Care Act, employer coverage, veterans, tribal health coverage. And you may, depending on your circumstances, end up having to transition from one system to another. None of that is automatic. We put that onus on the individual to figure that out, and people end up falling through the cracks. And there are plenty of examples of governments ratcheting up paperwork requirements, verification requirements in order to reduce costs in these public programs. And if you look back at the Republican talking points during the debate over the so-called One Big Beautiful Bill, they were saying they weren't cutting Medicaid benefits. They were just cutting fraud, waste, and abuse. And there really is this tension between asking people to verify every detail of their life to qualify for health coverage, or taking their word for it, allowing them to sign an affidavit in order to make sure that you get as many people eligible signed up for coverage.
Levitt says that these changes aren't just hitting individuals, they're also harming small businesses.
If you think about who is getting coverage in these ACA marketplaces, it is workers for small businesses and the owners of small businesses who don't have access to coverage otherwise. It's people starting up businesses, entrepreneurs, people who left their jobs early, might be working part-time to make ends meet, waiting to be eligible for Medicare. It's the gig workers, right? It's the Uber drivers, it's the DoorDash drivers. It's the parts of our economy where people tend to fall through the cracks. The less stable this market is, the more likely it is that people will take fewer risks in starting up a new business and stick in a job they may not like very much at a big employer so they can get health benefits.
We're going to take one more quick break. When we come back, I ask Larry Levitt and Miranda Yaver what can be done about these premium hikes and what policies should we be pushing to prevent this kind of thing from ever happening again. Welcome back to Lever Time. So let's review. Health insurance premiums may be going up in 2026, crushing 24 million people. For the average American, enrolling in health insurance is already frustratingly complex, and small businesses are being forced to carry much of the burden. So I asked Larry Levitt, is there any way to avert this crisis? And could a death of 1,000 cuts for the Affordable Care Act actually end up opening a path for Medicare for all?
So open enrollment for the ACA marketplaces starts November 1st. If the subsidies, if the enhanced tax credits are extended before then, there's time to adjust everything. There's time for insurers to adjust their premium increases and time for states to review that. But we're getting really, really, really close for that to happen. And it's not even clear that if there is an extension, it'll happen before November 1st. It might happen in some end of the year package, since that's typically how Congress does things. So there's a very good chance, I think, that even if ultimately these tax credits are extended, that we go into open enrollment with people thinking they're not going to get the tax credits, with insurers having raised premiums under the assumption that they're going to have a sicker pool of people to cover. And the tax credits will retroactively apply to people, even if they get extended only at the last minute. But it will be very chaotic for people. They're not going to necessarily know what kind of help they're going to get when they're choosing to sign up for coverage.
I mean, I've heard it argued that those who make the Affordable Care Act unaffordable make Medicare for all inevitable. There was this argument at the time that the ACA was the first step towards something less complicated, towards something like a full-on solution. I think Obama called it something like a starter home, right? I think not well considered at the time was this could be a stopgap Band-Aid that somebody could also come along and just rip off the Band-Aid, and you're still stuck with a huge problem. I just wonder, looking long term towards a world where Donald Trump isn't the president, just like the long view here, what are the lessons the next time healthcare is debated in this country in a real way, in Congress at the national level? What are the lessons from this moment for that future moment?
The ACA was successful in getting enacted because it did not upend our entire healthcare system. It was incremental in that sense. It was a big incremental step, but it was an incremental step to try to patch the system. That in some ways made it even more complicated for people, but it has provided real coverage for tens of millions of people. So, I think an important lesson that when you make those compromises, which may be inevitable in our political system to get something passed, you may end up with something that really doesn't solve the problem and ends up in some ways more divisive than you would hope.
Yeah, and what I frankly worry about is that because the ACA was patchwork, incremental, and complex, that the collapse or the hollowing out of the ACA, which is what the Republicans are doing, looks to the average person who may not be paying attention to the politics, looks like government is just not working. Government just simply cannot be trusted. I was told that the ACA solved this problem, and now we are 15 years after the passage of the ACA, and the problem seems pretty bad, certainly not solved at all. And I was told that the problem was solved, and that if you're not paying attention to the context of what's going on, you're just struggling to get through your day, right?
Well, I think you look back to what has happened since 2021. When the Democrats came into power, they increased these tax credits that help people pay insurance, and another 12 million people have gotten insurance. That if you make insurance affordable for people, they will sign up. They want health care. If you make the system inviting to people. So I wouldn't underestimate the fact that we went through 4 years of President Trump where he was trashing the ACA day in, day out. Why are you going to sign up for a program like that? Biden comes in and is promoting it. We increased money for community-based navigators to help people sign up to navigate the complexity of the system and made it more affordable. That you can make programs like this work.
Larry Levitt seems to have hope that this current crisis could put comprehensive healthcare reform back on the political agenda at the national level. Health policy professor Miranda Yaver says that states may need to start that fight.
States are going to be feeling such a financial pinch on the Medicaid side. States are going to have a lot less financial wiggle room because of the federal, really just like institutional arson when it comes to policymaking institutions and access to core programs. I think, certainly if you're on a marketplace plan, shop around, see what options there are, do some research. If there's a consumer assistance program in your state, take advantage of it. Talk to someone who knows the ins and outs of health insurance, whether that's your state Department of Insurance, whether that's a consumer assistance program. A lot of people aren't familiar with core insurance concepts, and the result is that a lot of people choose the wrong plan for their needs. And so what that can actually result in is paying more than you need to. And so I think really trying to develop that mastery so that we can be the most informed consumers now that the federal government is making it that much harder for us.
I also asked Miranda Yaver for her take on whether insurance companies would ever accept Medicare for all. It's like we're trying to get these giant sharks, insurance companies, to not behave like sharks, right? It's like a for-profit company whose entire reason for existing is to maximize profits. The whole theory of the ACA is to get them to behave nicely when their entire reason for existing is to not behave nicely. Is this really the central problem?
Yeah, private insurance companies have fiduciary responsibilities to shareholders. This is not a critique of private insurance companies, but it is a critique of the system that houses this much power. And the ACA really has made this incredible progress. We went from about 49 million uninsured to about 26 million uninsured, but it did operate within the constraints of an imperfect system. And while I think that a well-functioning ACA does so much good, we're in this setting in which those in power are dead set on sabotaging it to the point where we may have to rethink where to go next. I think gradually lowering the Medicare eligibility age would be a good way to go, where we can have parallel public and private systems, but gradually increase the opportunity to enroll in Medicare, see how things work financially with a larger population. And that's one direction in which I've advocated, but which I think you can tell would be my preference, which would be Medicare and then allow for anyone to purchase whatever supplemental insurance that they want. But the question is, when is this moment going to happen? And if we were operating within normal, conservative, very conservative times, then I would say, well, people are going to be losing insurance. They're going to be outraged. The pendulum is going to shift and create a lot of new opportunities to have this robust debate about how to reimagine our healthcare system. But of course, in this period of broader democratic decline, really erosion and institutional arson, I think that there are a lot more questions about when that debate is going to happen and how long people can really afford to wait for it.
Thanks for listening to another episode of Lever Time. In our show notes for this episode, you'll find a link to the Kaiser Family Foundation study that digs into these health insurance premium increases. Lever Time is a production of The Lever. This episode was produced by Ariella Markowitz. It was edited and mixed by Ron Doyle. Our theme music is by Nick Campbell. You can subscribe to Lever Time on Apple Podcasts, Spotify, iHeartRadio, the PRX mobile app, or wherever you get your podcasts. For ad-free episodes, exclusive bonus content, and access to The Lever's entire archive of investigative journalism, please consider becoming a premium subscriber. Head over to levernews.com to learn more about becoming a paid subscriber, or click the link in this episode's show notes. I'm David Sirota. We'll be back on Monday with another episode of Lever Time.